your baby's lips and skin look pale or bluish? Are they having difficulty breathing? Are they also constantly sweating or tired during feeding? If yes, consult a doctor, since these could be signs of ventricular septal defect or VSD, which is common among developing babies. Babies with VSD are at higher risk for health complications, so remember that the time is ticking and we have to seal the gap. I am Mr. Aguilos, and with Mr. Angeles, Balasanos, De Luna, and Dela Victoria, we are here to help you be more informed and vigilant about VSD, its symptoms, causes, and how we detect and treat it. As future medical professionals, we believe that in doing this presentation, we are doing our part in ensuring that patients' healthcare concerns are treated and addressed. Let's begin. VSD is way more common than what we might think. It is a common congenital heart disease, which is present at birth, comprising 20% of all cases worldwide, and affects 2 to 6 babies for every 1,000 live births. Unfortunately, the Philippines does not have comprehensive data on the cases until today, since most of them remain undocumented. But here are some of the signs and symptoms that might help you, parents, detect VSD.
Babies that have VSD typically experience difficulty breathing, whether shortness of breath or fast breathing, resulting in excessive sweating and tiredness when they are eating. Since babies with VSD have trouble eating, they might also experience slow to no physical growth. Take a look at your baby. If they are very pale or have bluish lips and skin, they may have VSD.
This is because, normally, our heart has 4 chambers that are distinctly divided by walls and doors, and may or may not carry oxygen, which is needed for our body to function. On the right side, we have the right atrium and right ventricle, which carry the oxygen-poor blood to the lungs. On the left side, we have the left atrium and left ventricle, which carry the oxygen-rich blood to other parts of our bodies. Our ventricles, then, are supposedly separated by a muscular wall, the septum, to prevent the mixing of oxygen-poor and oxygen-rich blood.
But sometimes, due to our genes, environmental factors, and the diet of the mother, the septum may not develop and close properly, which results in holes through the septum. That's why VSD is called Ventricular Septal Defect, since it is a birth defect on the septum that separates the ventricles. As of now, we do not know exactly how and why VSD happens, but what we do know is that it is caused by the septum failing to close during pregnancy. Since the baby has holes in their septum, the oxygen-rich and oxygen-poor blood mixes, causing higher blood pressure in the lungs. This makes our babies feel extra tired since their hearts need to work harder to pump oxygen-rich blood throughout the body. On top of this, the blood flow, because it is irregular, is the reason why babies look bluish and have stunted growth due to the lack of oxygen. This is also why afflicted babies have abnormal heart and breathing rates.
VSDs can be classed based on the size of the hole. Small VSDs are less than 3 millimeters, moderate VSDs between 3 to 5 millimeters, and large VSDs between 6 to 10 millimeters. Small VSDs show no symptoms and may close on their own before a child turns 6. Moderate VSDs usually show no symptoms and may close on their own too, but may need to be monitored. Large VSDs, on the other hand, require babies to undergo surgery before they turn 2, since it can lead to heart and lung damage if left untreated. When VSDs worsen, they can severely and permanently damage the lungs or your baby, resulting in oxygen deficiency. As they grow up, your child might be more easily tired and have severe breathing issues, which limits their lifestyle choices. To detect these large VSDs, doctors can use a stethoscope to listen for a whooshing sound in the heart, called a heart murmur. They can also use an echocardiogram, which uses ultra-high frequency sound waves to create images of the heart. Both of these are painless and not invasive, so you don't have to worry about your baby.
Once detected, doctors can stitch the hole closed during surgery, or plug it with a device called an occluder, which is inserted by thin flexible tubes called catheters. Heart failure medications can also make the heart pump more effectively. With these, doctors ensure the baby can grow up normally and healthily.
And that wraps it up for VSD. With this, we hope that you've gained some understanding of the symptoms of VSD, its causes, and how we currently detect and treat it.
Don't forget to share what you've learned today with others to help inform them about VSD and possibly give them the chance to seek the medical attention they or their babies need.
If your baby shows signs of VSD, please don't hesitate to consult a doctor. Thank you. If